Hello everyone, and welcome to our new session called What is Heart Failure? With the collaboration of Baylor's St. Luke's Medical Center, I would like to welcome Dr. Ajith Nair. Dr. Nair is an advanced heart failure cardiologist with a focus on heart failure, cardiac transplantation, mechanical circulatory support, and pulmonary arterial hypertension. He has served in leadership role at Baylor College of Medicine and previously at Icahn School of Medicine at Mount Sinai. Welcome, Doctor. We are glad to have you with us today.
Welcome. No, thank you. I'm honored to be part of this. I appreciate it.
Thank you very much.
Thank you.
Today, Doctor, we are going to shed the light on what is heart failure, its causes, symptoms, and treatments. My first question is, what is exactly heart failure? Because when we hear about a heart failing, we think about a heart stop working. So does it mean that the heart is not working anymore?
Well, heart failure is a general term that encompasses sort of a lot of different entities, but at its root, it just means that the heart is not working properly, to provide blood or blood supply that the body requires. And so that could be due to a weak heart, a stiff heart, could be due to valvular heart disease. So it can be due to a number of different entities, but all of that leads to a combination of poor circulation and invariably some degree of volume overload, whether it's in the extremities or in the lungs, and that can happen at rest or with exertion. So it's a failure of circulatory support by the heart for many different reasons.
Okay, so doctor, what causes heart failure? We know that there's chronic heart failure, and we know that there is acute heart failure. What is the difference between them? And is it always genetic, or there's other reasons for heart failure?
Yeah, no, great question. There are so many different sort of reasons for heart failure. First, acute heart failure means that, generally a patient was doing relatively well, but over the period of whether it's a week, 2 weeks, they decompensate, meaning they get worse, and they present with heart failure. Now, this can be in the setting of background heart failure or chronic heart failure, and where someone has heart failure that's well controlled for a while, and then something, whether it's an arrhythmia or infection or some other medication, etc., causes acute heart failure. Now, chronic heart failure is what we usually deal with, and the biggest reason for acute heart failure that I left out is acute myocardial infarction. So invariably, if you want really acute decompensated heart failure and what we call cardiogenic shock, the number one reason is to have an acute myocardial infarction leading to myocardial dysfunction or heart dysfunction and heart failure. So there can be multiple different reasons for heart failure. One is, in the U.S. and most of the globe, the number one reason to develop heart failure is usually coronary artery disease. So we break it into whether it's what we call ischemic, meaning due to some sort of blockages, and that accounts for anywhere from 50 to 60% of the reason why people have heart failure. The other half is due to what we call non-ischemic, or you don't have any blockages causing the heart failure. And that can be due to a number of different reasons. Like you mentioned, it could be due to a genetic cause, where someone is born with some reason to have a heart that doesn't function over time. It can be due to other things, such as high blood pressure, diabetes. Those are some of the big things that can cause heart failure. Other things would be valve problems. So you have a problem with one of the valves, the aortic valve, the mitral valve. Those can cause heart failure if they leak, over time, less commonly if they're tight over time. And then there are less common reasons such as arrhythmias, abnormal accumulation of substances, proteins, infections, and that becomes important, obviously, over the last year in this global pandemic, where we've actually seen that COVID, has caused heart failure, both acute heart failure, and I think it's to be defined chronic heart failure. And we've actually done some work on that at Baylor St. Luke's and teamed up with some of the Washington University to look into that in the past.
Yeah. So are there any preventive measures that a person can take to prevent heart failure? And what are they? I mean, you have been talking about the blockage in the arteries. So I think lifestyle can help with preventing heart failure. Is it true?
100% true. And I think, if you look globally, as the population ages and we're better at treating blockages, the amount of heart failure is increasing over time. So, and it's an expensive disease. So as you mentioned, to the question, prevention is, key. And so number one thing is lifestyle, making sure that, basic things like your blood pressure is controlled. If you look at the blood pressure studies from the past several years, actually tighter blood control, actually one of the biggest things that it prevents is not so much, coronary disease or blockages, it's heart failure. And so, control of hypertension is like one of the big things, making sure you live a healthy lifestyle free of, potentially acquiring diabetes. That's one of the other big things. Also, being careful about substances. We've seen patients who have abused alcohol and others, other sort of illegal substances. Yeah. But lifestyle is maintaining a healthy lifestyle and the importance of following up with a primary care physician to make sure blood pressure, cholesterol, are controlled and that you're, at an ideal body weight free of diabetes. Those are some of the biggest things to prevent heart failure.
And doctor, people, they might be confused between heart failure and heart attack. What can you tell people? What is the difference between heart failure and heart attack? And are they related?
They could be related, but it's an important distinction to make. And it's something that, a lot of people get confused about. So a heart attack really refers to an acute blockage in one or more of the three arteries that feed the heart its blood supply. And that is, basically a heart attack. So it's a blockage that leads to lack of blood supply to the heart. It gets injured and you get chest pain and you can have multiple potential complications from, arrhythmias to heart failure. Heart failure, though, is very different. And heart failure, like I said, is a lack of the ability of the heart to provide enough blood for whatever reason to the body. So it's a different entity. Now, can heart failure lead to a heart attack? Usually it doesn't go that way. You can sometimes see, people who have injury to the heart who have really bad heart failure. So heart failure generally does not lead to heart attacks. Now, a heart attack could lead to heart failure either acutely or over time when you have many blockages and the result of a heart attack is heart failure. So I hope that, so really what we're dealing with is blockages as far as heart attacks are concerned, and either a weak, stiff, or non-functioning heart for heart failure.
And doctor, what are the treatments available for heart failure, and is it curable? Can someone be cured from heart failure, or is it chronic?
It could be cured depending on the reason for it. That generally is not always the case. So as far as chronic heart failure, some of the treatments include medications that have been studied over the last, 40 years or so. So we have fundamentally about, for chronic heart failure, if the heart's weak, And it's generally the heart should be pumping about 50 to about 60% of the blood, about 55 to about 70% of the blood every time it beats. If the heart's very weak, less than 35%, we have certain medications for that. Those include what are called beta blockers, ACE inhibitors. Along with ACE inhibitors, there's something called angiotensin receptor blockers, and as well as newer medications called ARNIs, ARNIs. There's something called mineralocorticoid receptors, and now there are certain diabetes meds called SGLT2 inhibitors that can be used to treat patients who have heart failure when the heart's weak, less than 35%. There are also medications to remove fluid, and then a host of other things that we can do. And it's a really long list. The good thing about heart failure is that there are many different treatment options, and as opposed to 30, 40 years ago when there was only a few, there are many different treatment options depending on the type of heart failure that you have. There are certain cases, if it's due to, say, an arrhythmia, maybe an endocrine problem like a thyroid that's overactive, an infection, sometimes, women who have heart failure after birth, those are cases where the heart function can return to normal after some time, and we just need to follow it closely. The other thing where you can have heart failure where it comes back, maybe due to medications, notably things like chemotherapy. So patients undergoing, chemotherapy, it's something that we follow closely, is how their heart function is doing, and it's a separate field called cardio-oncology.
And doctor, what are the symptoms we should look for to diagnose a heart failure? I mean, some people will go at a later stage to their doctor and they are in an advanced stage of heart failure. So what do you tell people, what they should look for if they feel, for example, tired all the time, or what are the symptoms that a person should notice?
So shortness of breath. That's one of the big things. So you've gone from walking, several blocks, taking that, 1 mile, evening walk, to now only being able to walk, 1 or 2 blocks. So shortness of breath, the inability to walk upstairs. So exercise intolerance, that's what, or exertional intolerance. So the lack of ability to do the same amount of activity that you were doing. Fluid accumulation, that can be one of the big things where your legs start swelling. Apart from that, people with heart failure can sometimes have chest fullness, chest congestion, and then lightheadedness, and fatigue and tiredness. I mean, generally symptoms are okay at rest, but then when you start exerting yourself, that's when the symptoms of heart failure really get worse.
Okay, so if a person is diagnosed at an early stage, it's better for the outcome of the treatments, I mean.
Correct. So I think early diagnosis is key. We don't want to wait until the patient has had, symptoms for a very long time, because, the sooner that we diagnose these things, the sooner that, we can implement treatment and avoid any, major problem that could happen, or long hospitalization. And there are certainly a lot of different reasons to have shortness of breath. It doesn't have to be heart failure. There can be lung issues and other metabolic issues, like low iron levels, other things, thyroid levels. So there can be a number of different reasons. And so that's why it's important to, keep track of the symptoms and, hopefully after that have a good physician that can diagnose it. And most of the time heart failure is, not diagnosed by cardiologists. It's diagnosed by the primary care physician or the internist.
So, and checkups, what do you suggest? A person at a certain age should do a cardiac checkup every year, for example? For men and women, it's the same for men and women, or it's different?
I think it's a little different for men and women. The heart failure is very interesting as far as how it presents in men and women. There are, if you look at heart failure in general, you can break it into heart failure where the heart's weak, or you can break it into heart failure where the heart's very stiff. We call the weak heart failure with reduced ejection fraction, HFrEF, heart failure with preserved ejection fraction. Actually, in a lot of places, the US, other places, that accounts for about 50% of disease. Heart failure with preserved ejection fraction, where the heart is sort of stiff, doesn't fill well. So that's something to keep in mind, especially women over the age of around 65 or so. This is something that they should keep in mind.
Okay.
With both men and women, if you have these risk factors, hypertension, diabetes, blockages, these are things that will put you at risk for heart failure. And I think, generally you should have, annual follow-ups with your primary care physician. And if you do have these symptoms, basic things like EKGs, looking at how much you walk and things like that can, be helpful to maybe give a clue that you may or may not have heart failure.
So some viruses and infections can cause heart failure. We know that. But when a virus is the cause of the heart failure, is it reversible? Or it depends on
yeah, it could be. Yes, it could be. When a virus causes heart failure, we generally call it myocarditis, sort of an infection of the heart, and that sort of infection can, be pretty severe, even devastating. But a lot of times it can reverse, actually. And so there are different viruses that can cause it, Coxsackie, a few other ones, but we've seen a number of cases where COVID has caused that too, so in the last year.
So did you see, what is the relationship between COVID-19 and the heart diseases? Because we know that many researches shows that the COVID-19 caused heart damage. So why is it related to the heart?
Yeah, so I think there's three things that the COVID can do. One is it can, accelerate. It can, we have a lot of patients with COVID that have had clots, and sometimes it can cause blockages. It can also cause arrhythmias or abnormal heart rhythms, but then it can also affect the heart itself, the muscle itself. And we've seen that there have been a number of studies, MRI studies in athletes and others that have shown that it can affect the heart. It can cause an inflammation. So the inflammation of COVID, the infection itself, where you have a lot of infection and what we call inflammation going on, that can cause the heart to be weak, and that can be very transient, meaning short-lived. We did biopsies, so we actually took heart muscle, and of these patients who we thought had heart attacks with COVID, we actually checked the arteries and made sure they didn't have blockages first. And when they didn't, we did actually biopsies or took samples of the heart, looked at it in the microscope and saw that, it was causing some problems with the heart. We thought it was, could have been due to the inflammation, but when we teamed up with Washington University in St. Louis, they had showed that, this COVID can directly affect the heart and cause loss of muscle cells. So I think, we still have to explore what exactly COVID does to the heart over time. But we've seen that it can cause dysfunction for a short time. It can make existing heart problems worse, but it may directly affect the heart in a number of ways that can cause permanent damage.
Mm-hmm. So do you advise people with COVID-19 after the recovery to do a checkup, for example, for their heart, even if they had mild symptoms, I mean?
Considering the millions that have had COVID, I don't think it's feasible to really do checkups on everyone. What we've been doing at Baylor St. Luke's and Baylor College of Medicine is that at Baylor College, we've had a post-COVID clinic. So for some of these long haulers that have had persistent symptoms, we've had clinics set up for these patients who have persistent symptoms. And apart from doing the lung exams, pulmonary function tests, chest x-rays, et cetera, we will do echocardiograms to see what the heart looks like. And then a lot of them have various fast heart rates, and we'll do rhythm monitors too. So I don't think it's feasible to do it for everyone, but if you have persistent symptoms that are, really causing day-to-day problems, keeping you from going to work, as opposed to just some fatigue, brain fog here and there. I think it's, probably important to follow up with your primary and then consider some of these clinics if you have access to them, these post-COVID clinics.
So lately, the FDA has approved the Pfizer vaccine for young people, but we heard that the COVID vaccine is causing certain inflammation in the heart muscle of young people. What do you know about that? Or what can you tell us about that?
Yeah, I think, as far as vaccinations are concerned, I think, since a lot of these have been fast-tracked, they haven't been studied as well as, certain other vaccines that may go through a couple of years of vetting. And so I think we know that sometimes the inflammatory response that these generates can be significant. I mean, the mRNA vaccines, for example, your body is actually making part of the COVID virus itself, and that can, trigger a variable, immune response. And so with that, there may be, significant inflammation that may, affect the heart. I mean, I think, for the most part, it's safe in, almost everyone, but I think with anything, whether it's a vaccine, medications, or anything, there's going to be sometimes idiosyncratic responses that happen. But, these were studied pretty well over, 6 months time. And so they shouldn't discourage anyone from getting vaccines, but just something to keep in mind.
So you are with the vaccinating young between 12 and 18 years old. Are you with this, or?
I'm with it. I think there's a lot to be said about decreasing transmission to prevent, even if it's decreasing transmission of virus that limits spread, even if it's asymptomatic, patients who are spreading it. So that you can limit variants. So I would encourage, ongoing vaccination. And I think, all of us here in the medical community are very, cognizant of the fact that these are sort of rapidly developing, these have been rapidly developed, albeit over, technology that's been around for 10, 15 plus years. But, I think, we have to take sort of the overall sort of benefit of these vaccines into account.
So thank you, doctor, for your time and for the instructive information you gave us about heart failure, and hopefully for more when you are available in the future also for more interviews. Thank you very much.
Okay, anytime. I appreciate it, and I'm really thankful for your time.
Thank you.